Hello students, myself Dr. Ankita Kalita, and today I am going to take a class on the topic of pulmonary rehabilitation. The contents are introduction, definition, basis for pulmonary rehabilitation, indications and contraindications, goals, team, assessment and components. The definition. Pulmonary rehabilitation is an evidence-based, multidisciplinary and comprehensive intervention for patients with chronic respiratory diseases who are symptomatic and often have decreased their daily life activities. Integrated into the individualized treatment of the patient, it is designed to reduce the symptoms and optimize functional status, increase participation, and reduce healthcare cost. Let us know about the rationale for pulmonary rehabilitation. Exercise intolerance is one of the main factors limiting participation in the activities of daily living who have chronic respiratory disease. The cardinal symptoms that limits people with respiratory diseases are dyspnea and fatigue. Let us know about the indications for pulmonary rehabilitation. It is indicated for individuals with chronic respiratory disease who have decreased their exercise tolerance level, they have exertional dyspnea and impairment of activities of daily living. These are also indicated in conditions with obstructive pulmonary diseases, restrictive pulmonary diseases, and restrictive chest valve diseases. There are also certain contraindications for the program, and these are conditions that might interfere with the patient undergoing the rehabilitative process, conditions that might place the patient at undue risk during the exercise training. Goals. There are certain goals set for the rehabilitation program, and these are to increase their exercise tolerance level and to reduce their dyspnea, to increase their muscle strength and endurance, to improve health-related quality of life, increase independence, increase knowledge of the lung condition, and promote long-term commitment to exercises. The benefits of pulmonary rehabilitation are it improves the exercise tolerance level, it reduces dyspnea, and improves the quality of life. There is a certain pulmonary rehabilitation team. This team is formed by the members of by a physiotherapist, by an occupational therapist, a psychologist, a primary health care physician, a social worker, a dietitian, a respiratory therapist, a specialized nurse, and a family friends. Assessment. It is taken by taking the clinical history of the patient, review of the pertinent records, educational assessment, and the physical examination. There is a test called stress testing. It is performed to measure the activity of limitation. Example is a 6-minute walk test. The major components of pulmonary rehabilitation are dyspnea management, exercise training, nutrition and body composition, patient education, and cognitive behavioral therapy. Now, let us know what causes the dyspnea. It is caused by increased central respiratory drive, weakness of the respiratory muscles, and abnormal central perception of dyspnea. Dyspnea is measured by an MRC scale where it is graded as first, dyspnea only with stressful activity. Second, dyspnea with uphill walking, climbing steps, or brisk walking. Third, patient cannot keep normal pace of walking. Fourth, patient can't walk more than 100-meter distance. And fifth, dyspnea at rest. Here is a dyspnea Borg scale. This measures the level of dyspnea. Next is the management of dyspnea. Dyspnea management is done by first, to reduce the ventilatory demand, second, to reduce the ventilatory impedance, third, improve inspiratory muscle function, and fourth, alter central perception. Let us know about the exercise training. Exercise training is the foundation of pulmonary rehabilitation program. Although exercise does not result in measurable effects on the underlying respiratory impairment, but it has a very positive effect to reduce dyspnea. Now let us know about the program duration and the frequency. 20 sessions are more effective than 10 sessions. Short-term intensive programs, that is 20 sessions in 3 to 4 weeks, found to be more effective. Outpatient rehabilitation 2 to 3 times per week for 4 weeks is less effective than 7 weeks. One supervised session is ineffective. Aerobic training intensity goes like this. Greater improvements can be obtained at 60% of maximal work rate above the anaerobic threshold compared with low exercise levels. Training respiratory patients at 60 to 75% of maximal work rate results in substantial increase in maximal exercise capacity. Work score of 4 to 6 for dyspnea or fatigue is usually a reasonable target that should be achieved. High-intensity exercises are defined as intensity which leads to increased blood lactate levels in the body. Strength and endurance. Endurance training is done by cycling or by walking. Relatively longer durations of higher intensity are adopted in endurance training. Now, interval training. This results in significantly lower symptom scores despite high training loads, thus maintains the training effects. Strength training has greater potential to improve muscle mass and strength. The sessions include 2 to 4 sets of 6 to 12 repetitions with intensity of 50 to 85% of one repetition maximum. A combination of strength and endurance training can also be given. Ventilatory muscle training. Inspiratory muscle functions may be compromised in COPD patients, so respiratory muscle strength is commonly estimated by measuring maximal negative inspiratory pressure, although this is a highly effort-dependent test. Exercise prescription for ventilatory muscle training are frequency at least 5 times per week, intensity more than 30%, duration 30 minutes per day. Training device should be a VMT device. Breathing frequency of 12 to 15 breaths per minute is recommended in the process. Need for psychosocial intervention. Increased risk of anxiety, depression, feeling of hopelessness and inability to cope up, difficulty in solving common problems, and failure to adhere to rehabilitation plan. Exercise prescription in brief we have mentioned here as frequency should be 3 to 4 times a week. Intensity, it should be a high intensity training program, 60 to 80% of maximum work capacity. Duration 25 to 30 minutes as tolerated by the patient. Mode should be continuous or interval. Combination of strength and endurance training is recommended. 20 sessions within 6 to 8 weeks. At least 2 supervised sessions. And monitor heart rate, dyspnea and fatigue. Thank you.